Welcome to Health Matters, a podcast presented by Wellmark Blue Cross and Blue Shield, where we invite Wellmark experts to discuss healthcare and health insurance topics that matter most. I'm your host, Kareem Amiri. Hello, everyone. Today I have Julie Enga, my longtime colleague here at Wellmark. She's a team leader of employee health and well-being. I've invited her here today to explore well-being trends for 2024 and beyond. So welcome, Julie.
Thank you. I'm glad to be here.
Awesome. Hey, before we really get into the meat of our conversation here, can you tell our listeners a little bit about what your team does and how they engage with employers?
Yes, definitely. So I lead a team of consultants and system specialists that actually represent our well-being products and services. So, Kareem, as you know, we work closely with you going out to employer groups and identifying their needs, and then bringing our solutions like a well-being platform, resiliency tools, financial tools, and a variety of other solutions that they can purchase.
Thanks for that. So, as you mentioned, you work so closely with our clients and our employer groups. What are you hearing today? That's what we're here to talk about. What are the trends that you're hearing about? What are the needs that you're hearing from our employers? We hear it on our team somewhat, but definitely want to get your expertise on it.
Yes. Well, definitely we know well-being is more important than ever. So we see more and more of our groups asking about it. I don't think what we've learned is well-being programs are not just a nice to have. They're actually becoming almost table stakes as groups are looking to attract and retain their talent. So it's important, and it's important to have a well-rounded program. So that is for sure continues to be a trend. What we heard from our own self-funded groups when we did a survey is almost 70% of them do have a well-being program, and about 75% were looking to expand it. So well-being programs are really important. That's definitely, I don't know if it's a trend necessarily, Kareem, but it's something that our listeners should note.
Do you think how people define well-being program has changed over time? And maybe talk about that a little bit.
Yes, definitely. Traditionally, well-being or wellness programs, everybody interchanges those words, were very much physical focused. And now they're really looking at all areas of well-being. We know we can't come to the table with just one type of program because we have so many diverse needs across the employees and their family members. And Kareem, that really brings us to the second trend is our employer groups and their members, employees and families, are looking for more personalized well-being programs. We can't do a one-size-fits-all. I remember when I started in the industry, there would be a single well-being program, and it would
like
be
a membership pass to the gym.
Yes, exactly. You do A, B, and C, and then you get this one thing. There was really no choice in what I do for my own health. It was more what the company felt I should do. And so our groups are looking for more personalized recommendations from our team, your team, and then they're saying, what can I present to my members based upon their need and interest? So personalized programs, personalized services, recommendations is really important, and it's a definite ongoing trend as we look forward.
That probably fits in that diversity and inclusion conversation as well.
You got it. And that is definitely trend number 3. You're just leading me right in here, Kareem. But diversity, equity, inclusion, and belonging are a topic or a focus for organizations across Iowa and South Dakota, and we know well beyond. And so that isn't exclusive to a program or any one thing that an organization can do, but they're also looking to say, how does my well-being program support diversity, equity, inclusion, and belonging? And that's an important, and it will be a trend in the future as we continue to look at our programs and services.
Glad you brought up those trends. Is there any other ones that you can think of, or?
Well, I think in those a little bit are point solutions or targeted solutions. So I kind of tuck that under the personalized area, but our employer groups and even their employees and their members are looking for solutions based upon their individual need. And so it might be a program, it might be a service, but point solutions have been around and they continue to be an important discussion with our groups. And I think you can probably agree with me, Kareem. Groups are always coming to us with, hey, I heard about this solution, or I heard about this other solution. What do you know about it? And so that definitely is in there, and I kind of tuck it again under the personalized.
So tell me a little bit more about, or tell our listeners a little bit more about the personalized support that members are looking for.
Yep. When I think of personalized support, I break it down in a couple different ways, Kareem. First, I mentioned our employer groups. They're looking for those solutions that they can bring to their employees or their members. Some of them want stress management, some of them want financial help. And so personalization at the employer group level is really important on what we bring to them. So as you know, because we've had this conversation many times, when your account team and the well-being consultants come to the table, we really know a lot about an employer group and what their claims are saying, what their demographics are. And so we're able to bring more personalized solutions to them because of the amount of data we have on their group. And so personalization at that level is important. We can't just lay out every solution and say, what do you want? We want to help them decide what makes sense for their employees and their members. And then diving in deeper, we started going there about members, employees. I think we all, you get online, you get on Facebook, Instagram, and you start to get personalized things. Things pop up based upon previous searches or what you have shown interest in. And so when I think about what our employer groups want and what a member wants is they want to see the information that's of most interest to them and maybe based upon their needs. So we know something about them. They said that they have a chronic condition. If we have a solution or if the employer group has a solution, we want to present those to them. This really comes from technology. And so our platform is one of the ways that we're able to present solutions to members at the member level because they're telling us a little bit about themselves. So not only what they're interested in, what the employer purchases or what the employer has already as part of their benefits or services. And so personalization at that level is really important. So when they need it, it's there, or when they want it, it's there. And so technology is the best way to get that delivered to a member, and that's something that we've worked hard to have.
I know we have a lot of cool things coming down the pike from a technology standpoint. So, really glad that those are getting into place now.
Yep, exactly.
So we talked about on a personalized level for an employee. How about from an employer level? Is there any differentiation we've learned for what programs or that might be more suitable for certain employers than others?
Yeah, great question. We actually, with all the employer groups that we've worked with and the different solutions, we've learned quite a bit. And so I'll use Mequilibrium. It's a resiliency training tool that we offer to our employer groups that's focused on building resiliency. So we all have went through lots of changes in the last few years, and that's where Mequilibrium can come in. We call it MeQ, so sometimes MeQ, we'll go with that for now.
I share my MeQ things with my wife and daughter.
Excellent. Yep.
Every once in a while.
Yep. It's a good one. Well, what we found is, and who came knocking on our door and who we outreached to initially was a lot of those frontline employees, especially after the pandemic. So teachers, healthcare professionals, they really have taken to having the MeQ tool on their phone and being able to use it when they need it. And so I would say they're predominantly female. They not necessarily a certain age, but they have easy access to their phone. And again, I'm not saying teachers have easy access. I have a daughter that's a teacher, and she'd probably scream if she heard that. But it's there when they get off work. And so that's the type of group that tends to resonate towards MeQ. Whereas we also have Enrich Financial Wellness, so it's helping people at various stages from a finance perspective. And actually, as we've gone out, both of these tools are good and they could work in any situation. What we found is some of those employer groups that have more hourly folks, they might provide a great pension, but they're not really talking about the general budgeting and those types of things. So mail, manufacturing the financial wellness tools have really resonated with that type of group. Kareem, as you know, we're bringing a new solution focused on chronic pain here in the next few months. And so we're diving down into the data to see who might be good, because we also want to use data. But I think this is going to be one that has both the digital touch and a personal touch, and that's going to be really important. We do know that people like digital, but they also want the personal touch. So I'm really excited to see how that one rolls out, and hopefully next time we talk, I can share some good insights from that.
I am as well. So thanks for sharing some of that insight and going a little bit more into that example. But I also want to touch on the trend that, having a healthy workplace culture is essential for DEI. We talked about that already a little bit, but I know this holds true for us at Wellmark. Your team has hosted a few webinars this past year specifically on this topic. Can you share more about what you're hearing? You shared a little bit before, but how that translates into well-being and some of the programs that we're offering.
Yes, definitely. So your memory is excellent because we did do 2 webinars earlier this year, or just about a year ago, with our employer groups. So we actually had employer groups come and talk about what they're doing to support equity, diversity, inclusion, and belonging. And we are actually doing a webinar here soon that gets into how that translates into well-being. And I think it's important to note that attracting and retaining employees, we know that DEI&B is important for that. When you look at research, millennials in particular, about 76% say that would be important when they chose an employer group. So if you don't have those types of initiatives going on or aren't speaking about it, it could make a difference in hiring and retaining that talent. And then about 60% say their employer's not doing anything for it. So you translate that into how do you do it in an organization? And I said earlier, it's not one single way. But when I think about the well-being initiatives, people are asking, how do you take that into a well-being program? And so the consultants on our team are working on having those conversations of what does DEI&B mean in a well-being space. So can anyone participate in your programs regardless of their ethnicity, race, health status, economic situation? Yeah. All really important questions. When I first started, it was, here's your well-being program and can everyone do it? Meaning if they have a disability or, and we thought
Hurdles
about that.
to access.
Yes, yeah. Exactly. So maybe they couldn't do a walking challenge. What's our alternative? And so we are very, I don't want to say simplistic, but really thinking about inclusivity in a much broader perspective. So some of the things that I encourage our employer groups to think about is when you're communicating, what pictures are you putting out there? Is it look like your population? Does it go across your population? When you're having health and well-being initiatives, I'm a dietitian, so I'll use nutrition as an example. What are you serving? Is it go across all races, ethnicities? Because we get very focused on everybody, we've been doing the same thing. So it really is looking across your well-being program and asking yourself or asking each other, those of you that are planning the well-being initiatives, can everybody participate? Does everyone feel included when we roll this out? Really important. So we will be diving into that specifically much deeper in an upcoming webinar, but it is something that we're going to continue to hear about.
Awesome. Thank you so much for sharing that. Your team does an awesome job, and I want to thank you again for joining the podcast today, and hopefully we get to talk again in the future.
Thanks, Kareem.
So if you want to continue the conversation about today's topic, please reach out to your Wellmark representative. And thank you for tuning in to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield. Take care.
This podcast is brought to you by Wellmark Blue Cross and Blue Shield of Iowa and South Dakota. Wellmark Blue Cross and Blue Shield is an independent licensee of the Blue Cross and Blue Shield Association. To learn more about Wellmark, visit www.wellmark.com. Enrich is a separate company that provides an employee financial wellness platform on behalf of Wellmark Blue Cross and Blue Shield. Mequilibrium is an independent company that does not provide Wellmark Blue Cross and Blue Shield products or services.